I'm Randy Engelhardt with Realign by Randy. Today I'm going to be doing the routine for wrist and hands from the newer pain-free version by Pete Egoscue. So this routine is focused on imbalance of muscles that are causing improper forces on the wrist and hands, symptoms like carpal tunnel syndrome, could be ligament pains on either side, maybe the thumb pain, Quervain's tenosynovitis, even arthritis. The forces from our shoulders and our elbows should be taking, if they're sometimes rounded or imbalanced or uneven, we're going to get imbalanced forces and friction through our wrists and our hands, especially if we don't have good mobility all through our upper arm rotating and even through our forearm. So all of this is connected even to the from the shoulders to the hips. So that's why this menu incorporates the whole body in, and there's not a lot of forces that will aggravate the wrists or hands in this routine. So when you're doing the routine, of course, skip any exercise that does cause pain for you. You can always try it again at a different time and see if it's working for you. Whenever doing any of these posture routines, it's important to, number one, get clearance and make sure you're okay to exercise. And number two, do the routine in order, in sequence, the way it's created. And if you need to skip something because of pain, that is fine. Or if you don't have enough time, then reduce the time of each exercise and the repetitions of each exercise, rather than doing half of it and skipping the other half. You'll get a better response from it. But if you are able to do the full routine and that doesn't hurt you in any way, then that's going to maximize your benefits. So let's go ahead and get started. Have a good day. Okay, we're gonna go ahead with shoulder shrugs. So this exercise is done with a wall, but if you don't have a wall, that is okay. You can do it just standing. When you bring your back against the wall for this exercise, you may or may not have your heels touching the wall. It depends on your backside, but I would focus more on having your back of your buttocks and your shoulders touching the wall. And then if your heels can touch, great. If not, it's okay to have your heels away from the wall. Now, you do want your feet nice and parallel by the outsides of the feet, so it's okay to feel pigeon-toed in your knees. We don't want to be turning out. We want to be turning nice and straight. And you let your back touch the wall. If you have a ponytail or something in your hair, you kind of have to move it. And then you're going to draw your shoulder blades back and squeeze them together, and then you will raise and lower and raise and lower. This exercise is helping the scapulas get more balanced and start moving and gliding, which helps with upper back extension or thoracic extension, and this helps to get imbalances out. So this is going to be 2 sets of 10 for this exercise, and I'm pausing for a second as I want to make sure we have some details here. I'm going to reset. So shoulder blades go back. We're going up and down. I will put more emphasis on the down than on the up, just because we a lot of times are holding our shoulders sort of up. So we're bringing them up, but we're also really trying to make sure we get that down motion, all the while keeping your shoulder blades squeezed together. If you cannot do that, I might just work on shoulder blade squeezes to begin with to help loosen the scapulas, and then it might become easier to add in this holding the scapulas while gliding up and down with the shoulder motion. Make sure you're relaxing your abdominals. You're not holding that intense. Relax your abdominals and make sure you're breathing. And this is shoulder shrugs. Again, 2 sets of 10. Moving on. Next up is standing shoulder rolls. This is actually one of my favorite exercises because it does a lot for the shoulders. it is moving the shoulder joint and the scapula joint and getting that mobility going, and it helps to decrease imbalances in the trunk and the spine. So when we do this exercise, we are standing with our feet parallel, and again, parallel by the outsides of the feet. Okay to feel pigeon-toed. You want to be mindful that your parallel isn't still turning out. And so we get into that position. Think about having your head over your shoulders, over your hips, over your knees, nice and loaded and stacked. And then the directions are to start with the forward rolls, which you actually start by pulling backwards and going up and around. We're going to do 2 sets of 10 in each direction. I do like to do 1 set of forward, 1 set of backwards, 10 and 10, and then do it again. I just feel like that motion helps to loosen things up, to go both directions alternating. So we are going to draw back with our shoulders and go up and around, back, up and around. And if you haven't done a lot of alignment exercises, you're going to find that you may not have as much mobility, or you're going to really feel a difference between the sides. So this is just something that improves as you do more of these exercises, and this can be the key to helping any pain, not just wrist pain, even your hip and your foot. If your shoulders aren't moving well, this is a great exercise to just help the body overall. Okay, so 10 of those, and now we're going to go up to go back, up to go back. So we're going to do 10 of these. I also want to just demonstrate a couple things here while I'm doing this. Is be mindful that your hips aren't going forward. That's a common pattern for people. So if they're moving forward like that, pull them underneath you. Sometimes if you have a lot of curve in your upper back, you're going to find that as you try to stack, something may be imbalanced because of some restriction. So you're going to just do your best to get your stacking of your low joints. Now I'm going to go back to I'm going to show this from the back view. This is the forward motion. So I pull back to go up and around, checking my feet, back to go up and around. And this will be the second set of 10 of the forward motion, making sure your chin is level to the ground, looking forward. And then we'll just turn around for the last set of up and back, being mindful of my feet. And this will be the finishing of this exercise. Moving on. Next up is standing wall with a block. So this exercise, you'll either need a pillow if you have a yoga block, or this is the posture blocks that we have. Even a small ball will work for this exercise. Ideally, you will have a wall to stand with your back against, but if you didn't have it, it's absolutely still beneficial to do it without the wall. But when I explain the exercise, it might make sense where if you can find your little sliver of wall, it's going to be beneficial. So we take our block and bring yourself to the wall. And the key is the heels do not have to be against the wall. It really depends on your body makeup of your structure, whether or not your heels are going to touch the wall. You want more of your buttocks and the back of your shoulders touching the wall. We are not forcing the head on the wall. So this exercise is about, actually let's get into position, I'll explain that. So feet parallel by the outsides of the feet. Again, okay to feel a little pigeon-toed, might feel a difference between your sides, but that's kind of creates the platform from the bottom up, is by having those feet straight to get an even pull on the muscles on the backs of the legs and upward. So the intent is to get all the low joints stacking on top of each other. So I get my butt against the wall, my back against the wall, and then I don't force my head against the wall. So I'm gonna just refix my hair so that it's not blocking my head from touching the wall. So many people will find that your head is very off the wall in this exercise, and that is okay. That's just where you start. You want to be where you're naturally relaxed, and you don't want to be in this forced position. Now, I have done a lot of aligning, therefore my head does touch pretty easily. It does depend on my day. If I've done a lot of sitting work for a whole couple days, and I haven't done some alignment stuff, then I will find that my head does not touch as easily. However, as soon as I do a good long routine, my head touches very easily because I've been working at this. So the idea is relax your belly, don't hold in your stomach, and just, you can notice what touches evenly. If you feel more pressure on one side than the other, that should even out as you go. Same thing with the shoulders. And again, the head may adjust. And then you relax your shoulders. And this is actually a 6 to 8, about 6 minutes. You can do it 8 minutes, but I think in the book, it talks about 6 minutes of standing here. And this allows the whole back line of the body. When I say the back line, I'm talking about all the muscles and then the fascia that covers them. So starting with the bottom of the feet, plantar fascia connects all the way through the calf muscles, to the hamstrings, to the gluteus muscles, to the back muscles, up all the way to the top of the head. The fascia actually comes right here to some of your eyebrow muscles. And all of that, by standing here, you're getting a slow stretch to the muscles on the back side of the body, and it helps for things to even out. And that's why with time, that's why you need so many minutes, is you will slowly find your head getting back on the wall. And all of this is important for the positioning of what's happening in your shoulders and your trunk, so that too much force is not going on your wrist. When your arms are in this position and too far forward, it really disengages from the wrist and the elbow, and we get too much force through those joints while we're doing our activities with our upper body. So we want much more loading and engagement and force happening in the stronger, bigger muscles through our trunk. Now, if you don't have time for the full 6 minutes, it's still better to do a few minutes than not. But if you're really trying to get out of some kind of symptom or pain, especially with your wrist, or if this is in any other menu, it is beneficial to do the full time. Something about the block, we're just holding whatever, just enough pressure to hold the block. You are tightening your thighs. That's an important cue as well, because that's going to create that pull on the back of the legs. So now, if you're someone who hyperextends your knees, I would be mindful to tighten a little bit, but with a little bit of a soft knee. I wouldn't focus on locking into a super hyperextension. And again, you can listen to your body. This is really important about doing these exercises, is you really have to be modify as needed for your body. And again, that's sometimes you need a individual session with somebody who's teaching this posture method in order to kind of get through something specific that you're not resolving. Sometimes the videos will work for resolving completely, and sometimes you might get partial relief or get relief from one symptom, not another, and there just might be more detail and focus that you need. So again, this is standing wall with a block, and you're not forcing your head on the wall. You are relaxing your abdominals, you are tightening your thigh muscles, your feet are nice and straight, and you're relaxing through your shoulders. And we are going to move on. Next up is the standing quad stretch. Now this stretch, you might already know, but I'm going to show you the version that is important for posture alignment. So you will need we have the posture block to use, or you can use a chair and it could be a box or some blankets, because you're gonna need to adapt to your height depending on how tight your quads, your quad muscles, thigh muscles, and hip flexors are. So this exercise will balance out the quads and the hamstrings as you stretch that, but it's helping the body decrease rotation in the pelvis and the trunk. So this exercise does a lot for the body, and it really, that full minute of this, if possible, will really help work on everything you need to work on. So, but again, if you're having pain or any reason why you can't complete the minute, doing it for a little bit of time is better than not doing it, or skip it if you need to because of pain. But again, tying this to the wrist, this is all about getting the whole body working together, getting the rotations out so that when you're using your forces through your arms, things are more balanced and even. So if I'm going to start with this for myself, it's good to have a wall to hold on to or a counter. Or you could even use, actually, this chair is pretty high. I could use the back of this chair. So I'm going to bring my leg up, and I feel like that was a little close, so I'm going to move this back. The idea here is to have both these legs in line with each other. So if you're here, then you're too high. If you can't bring the leg back, that's when you would do something lower. And when you stand, you're going to make sure you're loading your joints and looking forward and putting your chin down. The back of your foot is resting on the block. You're going to tuck your pelvis under and tighten this left leg. My right leg's bent, left leg straight. Tighten the thigh, and then I want to show something from the back view. Just checking to make sure you can see. Something to be mindful of is what's happening with this down leg is if it's going out to the side, that's super common. So you just want to activate your hip muscles on the side, and then you're going to get a little bit more out of this exercise. So it's stretching here, but you're activating and loading on these joints. And now pay attention to my shoulders. A lot of times I see this tension, so you want to relax your shoulders down. So my pelvis is tucked under, relaxing my arms. Again, being mindful of however you need to hold the wall. If you're having any of your wrist pain, wall, chair, counter, and then we would switch sides. So I'm going to demonstrate a little this way, other side. So I'm going to use the wall sideways for this. I'm about to be done. Sorry for the interruption. And I am going to turn sideways, and I put this foot, my left foot now on, but you can see how I've lowered the height. Some people may need this height. You can even flip this around and you can use the back of the chair if you don't have something like this and you need a higher level. So even for me, because I can do a higher level, I can do this. And again, I am using the sidewall. I do think having something in front is a little better, but I just feel for demoing, this way you can see that I tucked my pelvis under, I'm dropping my shoulders, I'm tightening my right leg, and I'm being mindful that my right hip is not jutting out. And then I'm holding this exercise for a minute, and make sure you relax your abdominals and you breathe. Okay? Moving on. Next up is hanging. Now this exercise, again, stretches the back side of the body, especially if there's imbalances from right to left. So again, if you're having a pain on one side of the body, most likely there's something about the body is imbalanced between the sides, whether it's rotating here or elevation. So these muscles on the back can be pulling uneven. So this is going to help untighten things and also balance the muscles as well. So In the book, it doesn't show any kind of modifications or props or anything, but I do think this is one, depending on your body, there are some great modifications for it. You could have a block, a yoga block, you could have a chair, you could use the posture block if you have that. What I find is that this exercise, again, as it's traditionally directed, you would, no matter what height you can go to, you just let your body hang. But what I find is some people with different back symptoms might feel comfortable if they're more supported with the exercise. When we start hang, we are going to parallel our feet. Again, remember, parallel the feet by the outside of the feet. Okay to feel pigeon-toed. We start there, and then when you bend forward to hang, the key is not to have, let me come forward a little bit so you can see me a little better. The idea is not to have your butt behind your knees and your ankles. That is a very common thing. You may need to film yourself to see this. So what you want to do is think about bringing your hips over your leg bones, over your femur bones. And as you do that, you may be able to drop forward. Now, there's a lot of places where we can get hung up here, is depending on if you're not moving well in your pelvis, too tight in the low back, the upper back, or the neck. But now that we've done some of the exercises, it might loosen up. But modifications here is you can always use a chair if you're really, really tight. You could just hang like this, and that is the instructions, and you can be 1 minute. But if you feel like you needed support, you can have this height to kind of play around with what feels right to you. And also get this height. And sometimes it really depends on what you've been doing before this, how your body's gonna feel. For me, so you can go to different heights. I can get to the floor when I'm well aligned. So hopefully that didn't block your view. But I might feel a little bit more like I can really relax into it with this support. And then I can shift forward and make sure I'm nicely loaded. So that is what I like the extra support for. But again, you don't really need any props. You can totally do this exercise with nothing. And again, that full minute is very beneficial, but by all means, listen to your body. Again, skip this exercise if it doesn't work for you. Next up is wall clock. This exercise is great for getting the scapulas to work fully. Now, this is a more intense exercise for the scapulas, so this one you might need to hold off on if it's causing any pain in elbow or anywhere else, shoulders, tension. But it's one of those exercises you might need to hold off, and as you're feeling a little bit better, try it again and just see if it works for you. And it's 1 minute for the 3 positions, 1 minute for each of the 3 positions. Again, if you need to, you can start with 20 or 30 seconds of each position and build up to the minute. So you'll need a wall for this one. Again, if you don't have a wall, it still is a good exercise. You still could do it without having a wall and get something out of it. So I'm going to face the wall in a moment, but I'm going to do some more cues before I turn around. So this one, you're going to do pigeon toe with your feet. So you bring your toes touching and you tighten your thighs, and that is the leg position. And then you're going to have your arms straight up to start. We're going to do 3 positions. I'm going to go over the hands in a second, and you're going to do about midway, and then you'll be doing out to the side. Those are your 3 positions. So with the hands, it's called golfer's grip. You are going to bend the first knuckle here, and then you have thumbs pointed out like this. And you really want to bend this well. A lot of people will be here, but I'm just trying to show the details. It's a little hard to do if you're not used to doing it, but That's what golfer's grip is. And then arms will be down. And again, be mindful of what's happening with the wrists and the hands. Obviously, if you need to modify this based on what's ever personally going on, you can do straight hands instead, even stretch out the fingers as best you can with the wall. Pigeon toe my feet, get close to the wall. Relax your abdominals. I have my golfer's grip with my hands. Forehead can touch the wall. And I'm gonna try to relax my shoulders down, but really engage through my hands. Straight elbows if possible. And I'm just gonna tighten my thighs, make sure my legs are really engaged. And that's, again, part of helping the pelvis even out is really engaging the legs by that position. So we're doing this position for a minute. And then we will move on to this position. Again, I'm demoing, so I'm not necessarily doing the full time right now. So as we do this, again, make sure you're breathing, relaxing your abdominals, and relax those upper shoulders. It's very common to want to create tension up there. But this helps the shoulder blade move in different position. It's stretching and releasing the fascia and the muscle around so they can move more freely. And then they can work more and take more of the forces through the shoulders rather than putting them into the elbows and the wrists and the hands. Okay, I'm gonna move to this one, and this one would be the most difficult. One other element that I am not emphasizing is that you're rotating outward. I think it happens a little more naturally here and here, but when you get to this position, you'll really feel the tightness for the need to do external rotation with through your shoulders. We're trying to do this rotation through the shoulders. So rather than just trying to force through the wrist, because that might pull on the hand. So you're trying to rotate your thumbs to point outward, but through your shoulders. If you are struggling, it's okay to start here, but we're working on this motion. Again, tighten the thighs, relax the abdominals, and breathe. And again, I'm trying to emphasize my fingers, relax down, and holding this for a minute. Okay, last up is air bench. So this exercise puts the hips, knees, and ankles all under load while in flexion, which is a bent position. So that activates those muscles in a different position that we might have from the other exercises where the legs were straight. So now this one is super important for safety, is to either have shoes on. You're gonna need a wall for this, and if not, you could just do a free knee bend, but for the purpose of this exercise, if possible, a wall really makes a difference for what we're trying to gain from this. So you either need to have shoes on or have a yoga mat and bare feet. Since I have my socks on today, I am going to slide my shoes on. So there's only a few exercises in the posture program that shoes are helpful, but this is one of them. So you are going to lean your back against the wall, and you're going to walk your feet out. And we're going to go to just above 90 degrees. And you do want your feet in front of your knees. So you don't want to do this with the exercise. You want to be further out. And then you are going to press your back into the wall. And you can put the weight through your heels and really use your legs to do this exercise. And even somewhat of your abdominals on this one can work. And we're going to hold this 1 to 3 minutes. Even 30 seconds is still great with this exercise. And then you build up with what you're doing. So you press your back into the wall. You do not force your head on the wall. It's not this. This is about taking the tension out of your back and evening the back muscles. So again, it's all about how are we going to help our wrist. We've got to make sure everything in the center of the body is more balanced so the forces can be used more through the body rather than falling into the wrist, to the hands, the elbows. And I am just putting that weight through my heels, pressing my back in, letting my head be. Hands could be down, hands could be on your legs. And again, you are holding this 1 to 3 minutes. We have completed the routine for wrist and hands. Hopefully you are feeling a little better at this time. Just a couple reminders. I am Randy Engelhard with Realigned by Randy. Please like, follow, and subscribe. If you would like a one-on-one session because you need more personalized help in relieving some of your symptoms, you can go to my website. You can send a message and I can help direct you on the comments below. I do have a couple different options for virtual and in person if you're in the Florida area, and there is another version of just sending pictures and getting a routine without having a meeting. So we've got some great options if you need more help. Have a great day.